Good afternoon, thanks for joining us again today. As usual, I'll give you today's statistics. First of all, the total number of positive cases reported yesterday was 1,782. That is 11.5% of the total number of tests carried out and takes the number of confirmed cases in Scotland now to 151,548. 595 of today's new cases were in Greater Glasgow and Clyde, 307 in Lanarkshire, 194 in Lothian and 144 in Ayrshire and Arran. The remaining cases were spread across the 7 other mainland health board areas. I can also confirm that 1,664 people are currently in hospital, which is an increase of 126 from yesterday. And that figure means that the number in hospital now with COVID is quite a bit above the peak of the first wave back in April. 126 people are in intensive care, that's 3 more than yesterday, and I'm sorry to say that 1 additional death has been registered in the past 24 hours of a patient who first tested positive over the previous 28 days. You will recall, though, that the figures we report on a Monday can often be artificially low because registration offices tend to be closed at the weekends. Since the last media briefing on Friday, we've recorded 97 new deaths in the daily figures, and that means the total number of deaths under the daily measurement is now 4,969. As always, that total reminds us of the heartbreak that is being caused by this virus, and yet again today I want to send my thoughts to everybody who is grieving a loved one because of COVID. Now, I'm joined today by the Chief Medical Officer. He will answer questions with me in a few moments. Before that, though, there are a few issues that I want to update on. Firstly, let me begin by acknowledging that today sees many teachers, parents and young people embark on another period of homeschooling. There are a range of resources and support available. However, I know some of you might be having an issue this morning with Microsoft Teams. This is not an issue that is unique to Scotland or indeed unique to schools, but I understand Microsoft is currently working to address it. But more generally, I don't underestimate, and I want to be very clear about this, how difficult this is, both from an educational perspective, how difficult this is for young people, not just learning at home, but learning away from your friends. And I want again to say to all of you directly, thank you for your patience and your resilience right now. You're having the toughest of times, but you are coping with it extremely well. So thank you for that. And it's also really difficult for parents having to juggle homeschooling with working. So I want to acknowledge all of that today. It doesn't make it easier for you, for me to acknowledge it, but it's important that I do. And also give an assurance that we will continue to provide as much support as possible. And again, to thank all of you for what you're doing. We all want schools back to normal just as soon as it is safe and possible to do that. And while I can't give certainty on that right now, I want to be clear to you today that getting schools back to normal remains a priority for us, as I'm sure it is a priority for all of you. The next issue I want to cover is vaccination. From today, as you know, we will be publishing daily figures for the number of people who have been vaccinated in Scotland. So I can confirm today that as of yesterday, 163,377 people had received their first dose of either the Pfizer or the AstraZeneca vaccine. In addition, from this morning, more than 1,100 vaccination sites are now operational across the country. These are mainly GP practices and community vaccination centres, but as our supplies of the vaccine increase, the number of venues will increase further as pharmacies and mass vaccination centres also start to come on stream and be used. For the moment, though, the fact that GP practices and community centres are now being widely used for vaccination is an important milestone in the vaccination programme. And I can confirm again today that our aim is for all over 80s to have received their first dose of the vaccine over the next 4 weeks, and for all people over 70 and those in the clinically extremely vulnerable group to be offered vaccination by around the middle of February. We are working hard to get through this vaccination programme just as quickly as possible because, of course, it is the main route out right now of the situation we all find ourselves in. And I'm very grateful to everyone, and there are a lot of people in this category who are working really hard to make all of this possible. My next update relates to an announcement that was made earlier this morning about court proceedings. The Lord President has announced that the majority of summary trials in the Sheriff Court and Justice of the Peace Courts will be adjourned. Summary trials, of course, being those which don't have a jury. This step will reduce the overall number of criminal trials taking place during lockdown by up to 75%. And it means that from tomorrow, witnesses should assume that they are not due to attend court unless you're contacted by the Crown Office to confirm that the trial is going ahead. In the coming weeks, the court system will focus on the most serious cases. That means criminal jury trials in the High Court, and the Sheriff Court will continue. Jurors will attend remote jury centres which have been established to create a safe environment during the pandemic. In addition, most non-criminal court business will continue, such as online proceedings for important civil and family cases. We believe that these changes represent a proportionate response to the recent increase in transmission, and they will help to keep people safe from COVID while enabling the most serious criminal and civil business to proceed. Now, finally, before we move on to questions, I want to confirm a change that has been made overnight to the travel rules for people coming from Dubai. As you know, our basic travel rule is don't travel right now. You can't leave the house just now except for an essential purpose, and therefore none of us should be travelling anywhere, including outside Scotland, except for a genuinely essential purpose. Anyone who does go overseas must quarantine for 10 days on their return to Scotland unless they're returning from somewhere on the exemption list or are claiming one of the sectoral exemptions which can apply in certain limited circumstances. Dubai was on the quarantine exemption list, but since the 3rd of January, more than 50 people have tested positive for COVID in Scotland after returning from Dubai. Now, let me be clear, that doesn't necessarily mean that they got COVID when they were in Dubai, but the volume of positive cases strongly suggests that there may well be significant risks attached to travel to and from Dubai right now. As a result, it has been removed from the exemption list. This change came into effect at 4 a.m. this morning, and that means anyone who arrives in Scotland having been in Dubai must now quarantine for 10 days on their arrival or return. In addition, we're strongly recommending that people who have returned since the 3rd of January, but before these new rules come into force, should self-isolate until 10 days after their return. All passengers who've been on flights from Dubai to Glasgow since the 3rd of January will be contacted in order to underline the importance of that message. But of course, the most important message I want to stress is that unless your trip is genuinely for an essential purpose, it is against the law right now to travel to and from Scotland at all. All of us should be staying at home as much as possible. Now, unfortunately, and I mean that, I have to say, it's impossible for me to talk about Dubai today without making some mention of the situation with Celtic Football Club. Indeed, I would anticipate that I may face questions about this shortly. And I can't tell you how disappointed and frustrated I am to be facing another briefing that may, though this is of course up to journalists, be dominated by football. Football and elite sport more generally enjoys a number of privileges right now that the rest of us don't have. These privileges include the right to go to overseas training camps and be exempt from quarantine on return. And it is really vital, obviously for public health reasons, but I think also out of respect for the rest of the population living under really heavy restrictions, that these privileges are not abused. Now, I know that what I'm about to say won't please everyone. Nothing I can say about football ever pleases everyone. But as I have said before, I do have doubts based on how the club itself described it, doubts about whether Celtic's trip to Dubai was really essential. And I have doubts based on some pictures I've seen about whether adherence to bubble rules was strict enough. Celtic now have a positive case, and another 15 playing and coaching staff are being required to isolate. Now, as in any situation like this, it is for the football authorities to decide whether further action is necessary, and it's for them to consider that carefully. But this whole episode should underline how serious the situation we are in right now is, and why everyone, including football, should be erring on the side of caution. I know fans of other clubs feel very strongly that the whole of football should not pay the price for the actions of any one club, whoever they may be, and I agree with that. But of course, a situation like this does make it essential for us to review the rules, including those around travel exemptions, and that's what we will be doing. But as we do, I would hope that Celtic themselves will reflect seriously on all of this. The overriding message for everybody right now is that we are in the midst of a very severe global pandemic. For Scotland, this is the most perilous and serious position since the start of the pandemic. The overriding message for all of us, the one I want to end on today, is stay at home. The first point I covered today, the expansion of our vaccination programme, gives us the reason for optimism and hope. It shows how in the coming weeks and months we can make progress in tackling the virus and move to a point where these restrictions can start to be lifted. But at the moment, we are in a really dangerous situation. I hope we'll see case numbers stabilise in the days to come, but that will only be possible. And if we do achieve it, it will only be sustainable if we all stay at home. We already have more people in hospital with COVID than at any time since the pandemic started. That is putting our health service under strain, and our current case number means that this pressure will continue in the weeks to come. So all of us must try not to add to that. Especially with the faster spreading new variant, all of us need to do everything we can to stick to the rules of this lockdown. And that means, first and foremost, only leaving home for essential purposes, caring responsibilities, essential shopping, work that genuinely cannot be done at home, and essential exercise. Let me just say something very briefly about exercise. When we mean go out for essential exercise, that's what we mean, to get exercise, to get some fresh air. We've not put limits on that like we did in the first lockdown, but we don't mean by essential exercise going for a day trip with other people to the beach or to a park. I know that sounds harsh, but it is really important right now that all of us stay at home as much as we possibly can. And when you are outdoors for essential exercise, if you are mixing with another household, it must be a maximum of 2 people from 2 households. It's really important that we stop this virus transmitting as much as possible. Everybody, of course, should be working from home if possible. And I'd say again to employers, if your staff were working from home in the lockdown last spring, they should be working from home now. So please make sure that they're able to do so. And finally, just to remind everybody of the facts advice that helps stop transmission when we are out and about. Face coverings, avoid places that are busy, clean your hands and surfaces, use 2-metre distancing if you're talking to somebody from another household, and self-isolate and get tested if you have symptoms. These measures are effective even against this new variant of the virus. But fundamentally, the most important thing we can all do right now is stay at home as much as possible. That will protect ourselves, others, our communities, and it will help us all right now to protect the NHS and save lives. So thank you once again to everybody who is doing that, and let me leave you with the strong message that I hope you will all adhere to and spread to as many people as possible. Stay at home, protect the NHS, save lives. Thank you very much indeed for listening to what I know was quite a lengthy update today. I'll go straight to questions now, and the first question today comes from Raman Bardwash from STV.
Good afternoon, First Minister. Last week, you said that Celtic's trip to Dubai should be looked into. In light of what has emerged since then, 1 positive COVID test and a total of 16 self-isolating, what do you think should happen now in terms of what the football authorities do?
I think the football authorities, as I said last week, should look at whether the trip was essential and whether they want to reflect on that and give advice to clubs about the circumstances in which it is reasonable to travel right now and the circumstances in which it isn't. And you know, that's not me picking on football. Every time I mention football, I get pelters for most things. That's part of my job. I'm not complaining about it. But any mention of football, I get pelters from one side or the other saying that I'm somehow saying these things out of, a partisan view about one club or another. I don't have partisan views when it comes to Rangers and Celtic. You might have noticed I'm not the world's biggest football fan. My sole preoccupation at the moment is trying to persuade everybody to behave in a way that limits transmission. Elite sport, and this is not all just about football, elite sport have privileges because we want our sports people to do well and be able to train. But those privileges can't be abused. You know, fans of football clubs right now, fans of Celtic Football Club, aren't able to travel freely. We're all under the stay-at-home restrictions. So if you've got privileges, you shouldn't be abusing those privileges, and you should be asking yourselves whether going to a training camp and then what you do at that training camp, whether all of that is necessary. And I really hope Celtic reflect seriously on this. You've got significant numbers of players now required to isolate. The coaching team, as I understand it, are amongst those that are having to isolate. That's going to have an impact on their performance. So I hope they reflect on it, and I hope the football authorities reflect on it as well. We want to keep these things going as far as possible. You know, people have got few enough pleasures in life at the moment. I don't want to stop football fans watching their team, but teams and clubs have to take responsibility for their own conduct right now, just as all of us have to take responsibility for our own conduct and our own compliance with these rules.
In terms of football, if we come back in, if I may, how close are these privileges to being revoked?
I'm not talking today in terms of revoking privileges. I think one of the things that's really important here is that we try to see this from a public health perspective. And it's also, I know one of the things that football fans do get really upset about, whatever team happens to be in the spotlight, and therefore, you know, whatever fans feel that they then perhaps are seeing their clubs subject to punishment when it's not justified. And I understand that. So we don't want to take punitive action here that punishes the whole of football or whatever sport it might be that we're talking about, because there has been one episode that, and I know Celtic have got a different view to mine about this training camp, and it's important to say that. They think it was essential, it was about performance, and that they stuck to all the rules while they were there. So let me just be, you know, upfront about that. That's their view. From what I've seen and heard, I take a slightly different view about that. But we do, I mean, if you take the travel rules right now, travel is one of the risk factors in terms of not just spreading the virus here, but particularly when we're at a stage in this pandemic where new strains and variants are emerging. We want to limit the possibility for any of those that are developing in other countries coming into the country. So we're looking at tightening up travel restrictions. And one of the things I think out of this whole episode we will be looking at, in fact I know we will be looking at, is whether the exemptions from the quarantine arrangements for elite sport and perhaps some other sectors have to be tightened up as well. So I'm not saying that's happening only because of the Celtic situation, but it certainly, that situation underlines the importance of us doing that. Laura Goodwin from BBC.
Good afternoon, First Minister. The Health Secretary said this morning that Scotland's been allocated 500,000 doses of vaccine for use this month. How many doses are actually here in Scotland? And if we don't yet know how many doses of vaccine we're likely to get in February and March, how can we be certain of supplies for second doses and for the creation of mass vaccination centres? And for the Chief Medical Officer, there are calls for shop workers to be given greater priority in the queue for vaccines following the deaths of 2 shop workers in Greenock. Should they now be given greater priority?
The picture on the supplies that we have is changing all the time, and we have enough supplies to do the over 80s over the next 4 weeks that I've been talking about. We're also well through care homes, and we are well through NHS and social care staff as well. And the supply position has been improved because up until a couple of weeks ago, we had been advised to hold back half of our supplies to give everybody a second dose within 3 weeks of their first dose. We now no longer have to do that because the dosing schedule, the advice around that has changed. So we're now able to start using the half that was being held back as well. Now, we are getting a clearer idea of supply almost, every day that passes right now, but there are going to continue to be uncertainties because of manufacturing schedules and matters like that. But we will continue to vaccinate as quickly as we possibly can and get through the JCVI priority list just as fast as we can. I said last week that we wanted to do the whole of the JCVI list, at least with the first dose of the vaccine, by early May. I would be very, very hopeful that we will be able to accelerate that to an earlier point, assuming we get the supplies to do that. I'll hand over to Gregor on the point about prioritisation, but remember the JCVI list is based on those who are most likely, if they get the virus, to become very ill and die. And it is a priority list that starts with the most vulnerable to that, people over 80, care home residents, and works through the rest of that, those groups. And that whole list, of course, includes everybody over the age of 50 and people with underlying health conditions. And there will be many shop workers included in those priority groups.
So the aim of the vaccination programme that has been put in place is to try to protect those who are most vulnerable and to prioritise that protection as quickly as possible. The Joint Committee for Vaccines and Immunisation has looked at the risk associated with a number of different factors, and it's overwhelming that the evidence suggests that by prioritising those older age groups, we can protect the most vulnerable the quickest by doing this. And that's why, as you've set out the live-in groups that are currently there and within the JCVI prioritisation list just now, you'll see that it's very much determined by age, and you start to see some underlying health conditions coming into that as well. And once we are through that list of scheduled people in the first phase of the JCVI prioritisation, then the JCVI will be already turning its mind to how do we start to prioritise people within this second phase. And I'm aware that there will be discussions in terms of where occupational risk starts to come in that second phase as well. But at this moment in time, it's really, really important that we make sure that the most vulnerable across our society are protected first and foremost by this vaccine. And of course, that will capture many of the people who already work in retail and who either are in the age range or who have underlying conditions that would make them eligible for the vaccine as well.
James Matthews from Sky.
Thanks very much, First Minister. It's the first chance we've had to speak to you since last week's allegations by Alex Salmond that you misled Parliament. Jeff Aberdeen, his former Chief of Staff, is very clear about a meeting in your office on the 29th of March 2018. He said there was discussion about the investigation into harassment claims against Mr. Salmond, the process of it, the fact it was a civil service investigation being conducted by civil servants. He's very clear about that. Whose recollection of that meeting is correct, his or yours?
Look, these are matters that are under investigation both by a parliamentary committee of inquiry and also by an independent advisor on matters relating to the ministerial code. I will set out my recollection of events and my account of events to both of those inquiries, and people will draw their own conclusions. I am not, it's very important that I answer any questions that are levelled to me before these inquiries and that I'm open to full scrutiny. I do not consider that I misled Parliament, but of course that is for others to judge. At all times, I will seek to put the interests of the country first. That's the most important thing for any First Minister. And right now, the most important thing I have to do for the country is steer us through this pandemic. This is a briefing on the pandemic, and that's why I'm going to focus on that on this occasion and not go into other matters.
First Minister, if I may, why isn't this an appropriate public forum to answer a matter of extreme public interest?
I don't refute the public interest or the importance of these matters, but this is an opportunity, it has been since March last year, for me to brief the country on COVID. There are other forums where I will answer publicly. In fact, I would anticipate that the first
why not this one? Why not this one?
Because there are inquiries underway, and I think it is right and proper, out of respect to those inquiries, and actually out of fairness to myself, to have the opportunity at those inquiries to set these matters out properly and fully, and not do it as an adjunct to a briefing on a global pandemic that I am seeking to steer the country through. And I think that is right and proper, and that's how I'm going to conduct myself. I will put the interests of this country first at all times. That's more important than the position of any individual, and my primary responsibility is to continue to steer this country through the global pandemic, and that's what I'm going to do. And that means ensuring that this forum is dedicated to these really important issues. Bruce Mackenzie from ITV Border.
Thank you, First Minister. Turning to the south of Scotland, in recent weeks we've seen Dumfries and Galloway go from at the bottom of infection rate tables to the top of it. In fact, Stranraer now seeing some of the highest rates of infection in the country. we've seen a massive surge as well in the new variant there. Up to 89% of cases is believed to be the new variant. Is there a case for asymptomatic testing in areas like this where we're seeing such massive surges despite the lockdown being in place?
Well, testing is an important part of this. We've done some pilots around asymptomatic testing, and we'll be considering how we build on those. Anybody with symptoms should be having getting tested immediately. They have symptoms. There are asymptomatic tests carried out on, for example, social care workers, care home workers, and groups of health service staff. So there is asymptomatic testing in different parts of the population. The most important thing, though, whether it's in Dumfries and Galloway or in any other part of the country right now, we can do to suppress transmission of the virus is to stay at home, and that's the overriding public health message. Gregor, do you want to add?
Yeah, we've seen a very rapid increase in Dumfries and Galloway in the number of cases, but also the proportion of cases which have tested positive with the underlying variant of concern that we've started to speak about. This has been a feature which has been particularly evident in the Stranraer area, but I would say that it's not local, it's not just confined to that particular area. We're seeing evidence of that in other areas of Scotland as well. Probably Dumfries and Galloway has a much more significant proportion of the variant of concern, what we've called the S gene dropout, than any other area in Scotland just now, and that shouldn't be a surprise to us. Just over the border in Cumbria, we also see very high levels of the S gene dropout variant in circulation there as well. So there are a variety of ways that we can try to combat this. The most important thing is to try to limit the opportunities for transmission, and that's making sure that we are not going out, that we're staying at home, that we are only going out for absolutely essential purposes, and when we do need to go out, we're following all the facts guidance. Local authorities across Scotland are currently submitting proposals around about community testing. I think that community testing has a part to play in this, but the bottom line is the more opportunities we give for this variant to come into contact with other people, that will take it, and it will spread, and it will spread further. Once it gets into one household, it will go through that household because it is so transmissible compared to the previous variant of virus that we've been dealing with. So the best thing that people can do is not to give it the opportunity to catch hold in the first place.
Phil McDonald from Global.
Yes, sir. On the decision to adjourn the majority of court cases in Scotland, do you have any idea of what the potential repercussions might be for the criminal justice system? And also, what would your message be to victims who are already facing quite a lengthy wait for their case to be heard? And just one for the Chief Medical Officer as well, if I can. Just on the outbreak at the Abercorn care home in Hamilton, how concerned should we be about residents getting the virus there despite having had one dose of the vaccine?
I'll hand over to the Chief Medical Officer on that. On the adjournment of a significant proportion of court business, clearly that will have implications for the backlog of court work, and that will have to be worked through in the months to come. But this is about trying to keep people as safe from the virus as possible. It also allows the most urgent and serious court business to be attended to, and clearly for any victims of crime whose case is being delayed and adjourned, that is regrettable. But the arrangements allow the most serious cases to proceed and also allow the majority of civil business to proceed. That would include family cases, for example. But within those serious cases, I know that the Lord President wants to ensure that domestic abuse and issues like that are given a degree of priority. But like every other area of disruption to our life right now, we want this to be as short-lived as possible, but that depends on us getting and keeping this virus under control. Gregor.
Yeah, I know that Public Health Scotland are liaising very closely with NHS Lanarkshire and their public health team in relation to the outbreak that you speak about in Lanarkshire just now, and they're keeping me updated about it. Have done so over the weekend as well. I guess what we have to remember is that there is a period of time, a lag, if you like, before the vaccine takes its full effect, before the body's immune system begins to kick in. And then even after that, what we know about this virus is this vaccine is it's not a sterilising vaccine. People can still develop an illness, but it tends to be less severe than they would have had before. Sometimes it's asymptomatic, sometimes the symptoms are much less just now. What we need to do is to understand exactly the pattern of spread and disease within any care home where there's been vaccinations given, to see whether how it relates in time to when the vaccines were given and to how it impacts on those residents as well. And Public Health Scotland will keep me updated in relation to that.
Lindsay Hannah from Bauer.
Thanks, First Minister. It was just on the news that lower league football is now suspended. It was just to ask how much this is threatening the Premiership and Championship, and if you're confident that these leagues can continue safely.
Well, the decision was taken this morning by the SFA board, and there was Scottish Government consultation and input to that to suspend the lower leagues for a 3-week period, recognising the greater part-time nature of these leagues and perhaps the greater difficulty in ensuring the stringency of mitigations in place. The top 2 leagues are to continue, and I think everybody wants that to be the case for as long as it is possible to do that, and hopefully it will continue to be possible to do that. I know that the SFA are now going to be requiring this testing of players in the Championship, just as they currently do in the Premier League. So it's important that these things, and again, I'm not just talking about football here or even sport generally, across every aspect of our life right now, when we're dealing with a virus that is as fast spreading as this, and when levels of infection are as high as they are just now, everything has to be kept under ongoing review. But I know how important it is for those who follow football when so much of the other things that we do to relax and enjoy ourselves, to be entertained right now, are not available to us. It's important to try to keep these things going if we possibly can, but public health and public safety always have to come first, and that will continue to be the case. Tom Eden from PA.
Thank you, First Minister. Good afternoon. Last week you alluded to the fact that there may be more restrictions coming, and John Swinney said yesterday that the Cabinet were discussing whether the restrictions went far enough. Can you give us any indication of whether we should expect more restrictions in the coming days and weeks?
I'll be able to do that after the Cabinet has discussed it, which will be tomorrow morning at our weekly meeting. But again, I'm not trying to sort of shy away from saying, because I said it last week, the kind of issues that we will be looking at. Do we have to tighten up just to reduce the number of people that are moving around any further? And I talked last week about reducing perhaps click and collect to essential retail only, to maybe looking at putting further restrictions on takeaway. We've not reached decisions on these things yet, but these are the kind of things that we'll be considering at our meeting tomorrow, and then I'll set out any decisions that we reach in the normal way. I mentioned earlier on exercise, and I should say this is not so much about further legal restrictions, because the legal restrictions here are pretty stringent already. It's more about just getting a message across to people. I've had lots of people contacting me to say that, you know, parks are busy and, you know, the beaches are busy, albeit it's been freezing cold. And that's why I took the opportunity earlier on to say that right now, one of the reasons for being out of our homes is essential exercise. But we must see it as that, essential exercise. We shouldn't be going for day trips right now to parks or spending lots of time in places where there are lots of other people. If you go anywhere right now and it's crowded, my strong advice to you would be to come away from that. So we'll be considering if further restrictions are required, and we won't take any of these decisions lightly, but I would appeal to everybody to just think back to how we all complied with lockdown last spring. That's really what we should be doing this time as far as possible as well. Tom Martin from the Express.
Hi, thank you, First Minister. A couple of things, if I may. Just picking up firstly on your point there about, you talking about people going out into places being perhaps busier than they should. Does that not make the case for maybe tougher enforcement or tougher penalties of existing rules as opposed to, further rules? And secondly, if I may, for the CMO, just obviously big step forward going on with the vaccination programme with these centres opening today. But I just wondered what arrangements are going to be getting put in place for those who are perhaps a bit too frail or have difficulty actually getting to these locations, or even their GP surgeries to get vaccinated? How are we looking at getting these delivered in their own homes, for example?
I'll hand over to the CMO. On the point about enforcement, the Chief Constable was here with me on Friday and talked a lot about the police approach to enforcement and made the point that although Police Scotland, I think how he described it to me, I don't know if he used this line at the briefing, but had said it to me before it, you know, the police they're not being hard or soft, they're being appropriate and proportionate when it comes to enforcement. And Police Scotland, I think the Chief made this point on Friday, have issued more fixed penalty notices proportionately than the Met in London has by quite some distance. So they're taking enforcement action where that is required, and that will continue to be the case. Enforcement's not a first resort here. We all want people to do the right thing for the right reasons. But where there is a need to enforce, I know the police will do that. But all of us have a responsibility here. And I genuinely know how tough it is to be inside all the time, not to be able to do all the things we normally enjoy. And I understand the temptation to get out and about and go to a park or a beach. But every time people are coming together in busy places, that is a real risk of the virus spreading. The risks of that outside are lower than they are inside, but they are not zero. And therefore, crowded places outside and just as well as inside are places to avoid. So go out for your exercise. Back in March, April last year, we said to people only once a day for exercise. We're not doing that right now because it's important that people can get out and exercise. It's good for health and mental health as well as physical health, but please make sure it is exercise, that you're not in crowded places, that if you are with somebody from another household, there's only 2 of you, one from a maximum of 2 households, and that you're keeping 2 metres apart from each other, and that you're limiting as much as possible the time that you're outdoors, and you're absolutely limiting any time, or you're not being in spaces where there are crowds of people. Gregor.
Yeah, thanks, Tom. We're going to have close on 1,200 vaccine centres across Scotland, and over 750 GP practices who are going to be contributing to that. And what that allows us to do is to be able to provide those vaccines to people at a very local level. Now, the more people who are able to come to these centres, the greater we're able to, the faster we're able to kind of see them, because the greater the throughput that we have to that. But even beyond that, we recognise that there are some people where it's just too difficult for them to be able to get along to these centres. Now, every single year across Scotland, we've got a flu vaccination programme which accounts for that. We've got tried and trusted means of being able to deliver that vaccines to people within their own homes where that becomes necessary. The great advantage that we now have with the arrival of the Oxford AstraZeneca vaccine is the ability to be able to do that, because we're able to take that much further into the community and be able to give it to people there, rather than some of the logistical constraints that we've had with the Pfizer vaccine before that. So I'm confident that those people who are even unable to leave their home for health reasons or because of frailty, that we'll be able to get the vaccine to them.
Daniel Sanderson from The Telegraph.
Thanks very much, First Minister. Yeah, just to try and get some clarity on the number of vaccines that have been delivered to Scotland already. The Welsh Government said at the weekend that they'd had more than 250,000 doses of the Pfizer vaccine and another 25,000 of the Oxford jab. So just on a sort of rough population share, that should suggest that Scotland would have around 500,000 already. Can I just check, is that figure correct, or are there concerns that Scotland isn't getting its fair share of vaccines? And also, just separately, if I may, knowing what you know now, the case numbers and deaths that you've had to announce over the last week or so, do you now regret easing restrictions on Christmas Day? Thanks.
On the first point, no, your ballpark is broadly right. I mean, the precise numbers will change on a daily basis. If you remember last week, I said that by the end of January, we were anticipating having just over 900,000 doses. We'll have a significant chunk of that already. Some of that is coming at the end of January. The key point that I made a few questions ago is that until very recently, we had anticipated having to effectively hold back half of our supply to do second doses within 3 weeks. We don't have to do that now, so we have more supply that is in Scotland that is available to give people their first doses. So we will get through that and use that vaccine as quickly as possible while we're working to get greater certainty on the levels of supply that we have coming on stream after the end of January. And as I said, we are confident that we will do over 80s and complete care homes, and we're also well through NHS and social care staff over the next 4 weeks. And the next groups, which effectively will be everybody over the age of 70 and those in the extremely clinical vulnerable groups, we aim to offer vaccination to by mid-February. And we hope to get through the whole JCVI priority list by early May. But as I said before, I would hope that we can bring that forward if we have the supplies to do it. And your second question was Christmas. Look, I always reflect on, and you've heard me say this before, agonise on decisions we take and decisions we don't take over all of this. And I guess there will never be absolute 100% certainty in my mind that we've got absolutely everything right, because this is a really difficult thing to get right. What I believed before Christmas and still believe is the case is that had we not given some parameters around Christmas mixing, then we would potentially have seen more of a free-for-all, which would at least potentially have caused greater problems. So we deliberately tried to put some parameters around that. We then reduced that once the severity of the new variant became known to us. But it's the variant that is driving greater transmission right now because it is so much more transmissible. And it's that says that we need to all really knuckle down and abide by these restrictions as far as we possibly can. I don't know if you want to add, Gregor.
I think the only other observation I would make was that the rise in cases that we saw, particularly between Christmas and New Year period, actually predates that mixing together on Christmas Day, and the inference from that is that there must have been more routes for transmission between people in that period immediately before Christmas as well. So having this new variant so ubiquitous across our communities just now does mean that we need to be so much more cautious, and people in the circumstances that they find themselves in just now really should be constantly checking with themselves and asking themselves if they're not in their own home, why are they not in their own home, and do they really need to be outside just now. I think taking opportunities for pure exercise outside is a good thing just now, particularly at this time of the year, to try to get as much sunlight as you possibly can at this point in time in the year, but really got to balance that with the fact that the more often people are outside their own home, the more likely they are to come into contact with people who are carrying this virus and to spread it within their own homes.
Thanks. Gina Davidson from the Scotsman.
Hi, thanks, First Minister. Today, while you've been giving your briefing, there has been a gathering of people outside the Scottish Parliament protesting against lockdown, and they've been there without masks or adhering to social distancing, and fixed penalty notices have been handed out, which they say they're not going to pay. I just wonder what your message is to these people who are obviously, well, potentially COVID deniers, I suppose, and how worried you are about their reaction to the things that you're asking the public to do, and whether or not that's likely to spread further amongst the public, and also what your reaction is to the launch of this new Reform UK party, which is going to contest Scottish Parliament seats in May, because one of their positions appears to be quite COVID sceptic, and they certainly don't believe that lockdowns work.
I'm not going to get into new parties being launched. I have no... Well, yeah, I do have a view, but I'm not going to express it here today. On the point about the protest, and I've not seen what's been unfolding while I've been standing here, obviously, but that is an important issue. I mean, as you would expect, and as you've heard me say before, it's not something particularly earth-shattering here. I'm a passionate believer in freedom of speech and freedom of assembly, and people's right to protest in a democracy. But right now, coming together in groups is putting people at risk. It's putting people's health at risk, and frankly, it's not an exaggeration to say it's putting people's lives at risk. And I think it is deeply irresponsible to be doing that, whoever you are and whatever cause it is that you might be protesting for or protesting against. And to people who are COVID deniers, COVID's not a fake. It's not made up. It's not a figment of anybody's imagination. You try telling that to the you know, the 1,600 people in Scottish hospitals today suffering from COVID, the more than 100 people in intensive care suffering from COVID today, the more than 4,000 families who are currently grieving the loss of a loved one because of COVID. It's not made up, it's very, very real. And if you think that not wearing your mask or gathering together in groups or encouraging people not to take the vaccine makes you, you know, smart, I just think the vast majority of the population disagree with you and think that you are actually being really irresponsible. So I don't think the vast majority of the population are at all susceptible to that. I think most of us understand the severity of the threat we face and want to do everything we can to get the country safely through it. And I'm very grateful for the responsibility of the overwhelming majority of the Scottish people. And, you know, the law and the progress of the justice system will take care of those who willfully breach the restrictions that are in place right now and in place to protect public health. Michael Blackley from the Mail.
Thank you, First Minister. Good afternoon. Your message at the start of this briefing on travel was pretty clear. The basic travel rule is don't do it unless you have to, unless you have a genuinely essential purpose. It's against the law to travel. However, over the weekend, it emerged that Eastern European workers had been literally flown in to start work at Ferguson Shipyard, which is, of course, a Scottish government-owned facility. Are you concerned that this was allowed to happen and that they were subsequently seen queuing up without social distancing at the site? And does it not completely damage your message to the public and to businesses if a Scottish Government facility is not following the rules that you're telling everyone else to follow?
As I understand it, and I don't know all the details of the workers coming to the site, but it was a subcontractor and they have had the COVID rules pointed out to them. As it happens, Ferguson's is actually closed at the moment in order for a full review of its adherence to regulations and the safety provisions there to be properly considered. So that's the situation at the shipyard at the moment. Alistair Grant from the Herald.
Hi there, First Minister. Thanks very much. Just to touch on the allegations made by Alex Salmond just quickly, is there a risk that trust in you as First Minister and in your government is being undermined at a crucial time for the country and in the middle of a deadly pandemic? And should the public worry about you and your government becoming distracted by what's clearly a serious row with Mr Salmond? And could I just ask as well, just quickly, you've also touched on the fact that the exercise rule doesn't mean that people should be going on day trips to the park or to the beach. What about meeting someone outside for a socially distanced coffee or sitting on a bench, maintaining a distance with someone? What's the guidance around that kind of thing?
I'm not distracted. I'm focused 100% on steering the country through the pandemic. That is my absolute responsibility right now, and that's what I'm going to focus on. Other things will take their course and I'll cooperate, and as I've got a duty to do and fully do so with all of that. But I am 100% focused. I take nothing for granted in terms of the trust that the Scottish public have in the government about this or anything else, but all of the evidence is that that's not something that is in any way affected, but my focus is on steering the country through the pandemic, and I think that's what everybody would expect my focus to be on. In terms of the second part of your question, what we're saying to people is if you're outside just now, you can meet one other person from another household. So if there are two households coming together, that should be two people maximum from two households, and you can go for a walk, keep 2 metres apart. And, you know, I would, again, hard surfaces you should probably avoid if you can, not linger in parks and such like any longer than you have to. The stay-at-home rule is the one that's really important right now. So limit your time out and about to exercise, getting fresh air, perhaps seeing somebody from another household for that sort of socially distanced catch up, but make sure you're abiding by all the rules. That's really, really important.
You know, go outside to take exercise. It's important that we're still participating in physical activity. It's good for us both physically and mentally. but don't be going outside to meet each other, have a cup of coffee, sit on a bit of park bench and things like that. You're only putting yourself at risk, another person at risk as well. So, as the First Minister has outlined, there is the ability to be able to participate in that physical activity outside with one other person from one other household, but I certainly wouldn't be recommending to anyone that they're going beyond that. And I think anyone who's contemplating that really has to question whether that's an essential form of activity or not. I think it's good that we've got the ability still to be able to meet with people from other households in that way to take physical activity, because it has some impact on reducing loneliness that some people experience. But as I say, I think we've just got to be very careful that we're making sure that at all times we are limiting the ability for this virus to be able to spread to other people.
Christine Lavelle from The Sun.
Thank you, First Minister. On the lockdown, your advisor, Professor Devi Sridhar, suggested yesterday that 12 or more weeks of lockdown is necessary to bring down the prevalence of the virus. Is this the kind of timescale that you're looking at? And also, I just wanted to ask if you could clear up an issue that there's been some doubt about. Celtic said on the 4th of January that if the club had not received Scottish Government approval, then we would not have travelled. Did the Scottish Government give its approval for this trip to Dubai?
I've already covered that in a briefing last week, but I'll do it again in a moment. On Devi, I didn't hear Devi's comments directly yesterday. I've seen her on Twitter today take issue with a headline about 12 weeks of lockdown to say that that wasn't what she had meant. I think and I know Devi is of the view, and I think she's right, that we should be thinking our way through this year to get us out of lockdown as quickly as possible, and then look at what we have to do to keep the virus suppressed as we go into the summer, in order that it doesn't get out of control again, and get ourselves into a position ahead of next winter where we're not facing the same as we are facing this winter. Vaccines will play a part in that, of course, a big part in that, but we have to be thinking about the other things we've got to do. And I think the points she's making are sensible, but inevitably sometimes particular points are taken out of context. I don't have any certainty right now as to how long the current lockdown will stay in place. It won't stay in place for any longer than is necessary, but we must get transmission down, and we must be confident we can keep it down given the faster spreading nature of the new variant. On the point about Celtic, as I set out, I think last week, my understanding is we gave the footballing authority for Celtic clarity on what the rules were and are, and training camps for elite sport are permitted if it's in relation to performance or competition. So we set out the rules. It's not the role of the Scottish Government. We're not formally on the joint response group. It's not our role to give approval or not give approval to what a football team is doing. As I understand it, I think at the time that clarity on the rules was given, it was another country that they were planning to go to rather than Dubai. And also that was back in November. The world and the situation with COVID has changed quite a lot since then. And, you know, the club itself described the trip to Dubai as R&R. Now, I know they're saying it was about performance, but I do think there is doubt as to whether it was really a necessary thing for the club to have done. But that's for the club to reflect on. They are obviously dealing with the implications of having somebody test positive and having a number of others who have been close contacts of that person, and I'm sure they will be reflecting on things as a result of that. Callum Ross from the P&J.
Thanks, First Minister. Outbreaks have been confirmed by NHS Highland at 2 care homes in Invergordon, and there also seems to have been a fairly high number of cases in that part of Easter Ross. Sort of generally, I just wondered if there's any more, either if you could say about that situation or generally about Highland, and whether vaccine supplies might be targeted to those kind of areas at first.
Well, care home residents are, you know, the priority in terms of vaccination. So it's not about targeting vaccine supplies at them. They are already the priority, and we are about, I think, 70% of the way through giving care home residents the first dose of the vaccine right now. So that that is a priority given the frailty and the vulnerability of that particular population group. The situation in Highland is, as it is elsewhere in the country, serious and severe, with transmission at unacceptably high levels, and we have to work to get those transmission levels down in Highland just as we do in the Central Belt or in the borders. The only places where transmission is not at that high level, although as we saw in Shetland last week, we can't be complacent here, is in our island communities, and that's why it's really important that we don't have people travelling to and from them for non-essential purposes either, so that we're not risking taking the virus there. The Chief Medical Officer might want to say more about Highland.
Callum, what you've highlighted there is the simple fact that there is no area in Scotland just now that can afford to be complacent about what we're faced with just now, because we know that the new variant of concern is seeded widely across Scotland, that none of the mainland health board areas are immune to that fact, and that once it begins to exert its effect within these communities, it spreads very, very quickly. And that's what we've seen in some of the Highland communities, particularly around about Inverness, and particularly in some of the other localised, more dense communities in Highland as well. I'm afraid it comes as no surprise to me that we have seen the rise in cases that we have seen both in Highland and across more rural areas of Scotland over recent times. And again, my message to people is very much urging them to make every attempt just to limit their ability of coming into contact with other people and risk spreading this any further. If we can do that, if we can stay indoors, if we can make sure that we're not coming into contact with other people, that is our best chance of not taking this virus into other institutions, whether it might be care homes or our workplaces just now. We should constantly be questioning ourselves whether any trip that we're taking is truly essential or not, and whether we really need to undertake that.
Andrew Learmonth from the National.
Thanks, First Minister. Can I just ask for some clarity on breastfeeding? The lesson most of us received last week says mums should wait until they've finished breastfeeding before taking the vaccine. However, the advice from the JCVI has changed in recent days. But for breastfeeding mothers, there's still uncertainty about what they need to do. And following on from that, I've been contacted by a number of frontline workers looking specifically for guidance for them. At the moment, they say they feel they have to choose between breastfeeding and continuing to work. One social worker working with young children and pregnant women says she's keen to get the vaccine to protect the people she works with, but also wants to keep breastfeeding her child. Are you able to give her and other breastfeeding women clear guidance on what they should do?
Hand over to the Chief Medical Officer on this point.
With a very welcome contribution from both JCVI and in the new MHRA guidance that was issued with the release of the Oxford AstraZeneca vaccine last week, and that clarified the position both in pregnancy and on the use of the vaccines for people who were breastfeeding as well. And what it highlighted again is looking at the kind of a risk-based approach to that. It supported the use of the vaccine for those who were breastfeeding.
And lastly, Mark McLaughlin from The Times.
Good afternoon, First Minister. We've been hearing this morning about widespread problems with GLOW, the online learning portal. So could you maybe address parents directly who have been struggling with GLOW this morning? What's the problem? What are you going to do about it? And also, the definition of vulnerable child is can be a child whose parent is suffering from a mental health crisis. Would you encourage schools to take a more relaxed view on that if parents are really struggling mentally with the problems with the online learning? And on a related point to Dr. Smith, are we any further forward with the transmission of the new variant in schools? Do we know any more than we did a week ago? Today is the first chance we've had to review the first stage of your forecast from last Monday, which said, pessimistically, we would be at about 1,800 hospital cases today, and we're not far off that. Was that already baked in to that forecast, or are we on a pessimistic trajectory?
I'll hand over to Gregor in a second. I did address parents on the IT issues in my opening remarks today. Let me be clear, it's not an issue with Glow. It's affecting Glow, but the core issue is not with Glow. Glow authentication and login is working as usual. The issue is with Microsoft Teams. And I understand it's not an issue that is either unique to Scotland or indeed an issue that is unique to schools. Microsoft has confirmed that it's an issue that's affecting users across the United Kingdom and actually elsewhere in Europe as well. And it's not just schools, it's business and personal users that have been affected by this morning as well. Education Scotland has raised it with Microsoft. I'm sure they're not the only ones that have raised it with Microsoft, and Microsoft tell us that they are working to address that as quickly as possible. So it is affecting Glow, but just to be clear, the underlying issue is not an issue with Glow. I hope that issue will be resolved very soon, but I recognise that, you know, IT glitches aside, this is a really difficult time and experience for parents and for young people, which is why there is the range of support and resources available, and why we're determined to get schools back as normal as quickly as it's possible to do. And Gregor might have something to say about the new variant and what we are learning about that. On the issue of vulnerable children, I'm not going to give diktats to every local authority here about this, because there's got to be a bit of flexibility for local authorities to use and exercise their judgment. There's a very difficult balance we've got to strike here between having vulnerable children in schools, if that is deemed to be best for them, and also having an appropriate number of key worker children able to access education on the one hand, but on the other hand, not having so many young people physically in schools that we start to undermine the public health reason for having schools closed at the moment. Now, local authorities have guidance to steer them through these decisions, but they have, at their request, also got some flexibility to make sensible judgments, and I think that is right and proper. But I'll hand over to Gregor on the other points.
So in the first point, which is about transmissibility across all age groups, I guess, is that at this moment in time, there's no definitive answer to that. There is still discussion within the scientific community as to the implications. We're not certainly seeing a signal of any greater or disproportionate impact on younger age groups across Scotland at this point in time. And we're certainly not seeing any evidence of any more severe disease in any of the age group related to the new variant just now. So that is early work, but certainly it's encouraging that none of that appears to be evident at this point in time. I think it's some time yet before we'll see a definitive position in terms of transmissibility and what the impacts are on those younger age groups. But as I say, there doesn't seem to be a disproportionate signal across those age groups at this point in time. In relation to the projections for hospital admissions and so forth, what we've seen so far is hospital admissions which probably have their origin in infections in the period immediately before Christmas. I expect that we'll still see some further rises in hospital admissions to come. Not as many of those hospital admissions are translating through to a need for intensive care requirements once they're in hospital. We have better treatments available to us now than we did in the early part of the pandemic, and that certainly appears to be having a beneficial impact in being able to manage people within the general hospital wards. But make no mistake, those general wards and ICUs across Scotland just now are incredibly busy. We've got very tired staff who are providing care to this number of people, and unfortunately I suspect that with the step change that we saw just after Christmas that we've still got some rise in admissions yet to come. However, there is some encouraging news, because I think that when you look at the case rates that we're seeing over the last few days, they've perhaps begun with, I have faith, and I'm going to touch wood here just now, is that they've begun to slow down a little bit. And the 7-day cumulative incidence across Scotland just now certainly is not increasing at the rate that I would have feared it might be at this stage. And in fact, there may even been some signs of containment with the Boxing Day measures really starting to have their effect coming into play just now. So, as I say, I think we need to watch this very carefully, but there's some encouraging signs within the system just now that the cases are not as high as they perhaps could have peaked up.
So next week, next Monday, the forecast was 2,300 cases. Do you think we are heading away from that now? We're not going to see that next week, in your opinion?
I don't think we can say that with any degree of confidence just now, Mark, at all, I'm afraid. I think that we're starting to see impacts that are coming in here that we'll continue to model and look at closely over the coming days, and we'll see where that gets us to.
Okay, Thanks, Mark, and thanks to journalists. I think my closing message today would be that we cannot be complacent right now. We continue to be at a really difficult situation. We are hopeful that we start to see these measures contain and flatten the case curve, but we need to have more days data to be certain about that, and we will continue to see a tail. I hope it doesn't get to the numbers Mark's just quoted there for next Monday, but we can't be certain about that. We will still see, we think, hospital numbers and ICU numbers continue to rise, and unfortunately deaths continue to rise. But we have to abide by this lockdown to keep that hope of starting to flatten the case curve, so that while we will see the hospitalisation figures rise, we're not making it any worse than is already in the system. So that means all of us abiding by lockdown, difficult though I know it is, and making sure that we're not pushing the boundaries of it and looking for the loopholes in it, but that we're all staying firmly within the letter and the spirit of it. Cutting interactions with other households as much as possible, staying at home as much as possible, and reducing every opportunity that the virus has to spread. So thank you very much for doing that. Can I say thanks to Jill today for our BSL interpretation and to Gregor for his help with questions. But thank you to all of you for tuning in and for everything that you continue to do. But please, for now, stay at home, protect the NHS, save lives. I'll be back here tomorrow at the usual time of 12:15. But until then, thanks very much for joining us.